This is a study we started with Dr. Hota when he was joining us at UCLA from Japan. This is about PSMA-targeted radionuclide therapy with lutetium PSMA therapy. It's a theranostics approach, so you use an imaging scan, PSMA PET scan, to assess the amount of target expression to make sure the PSMA therapy will go in a sufficient amount to the lesions. The VISION criteria, VISION is a trial that led to the approval of lutetium PSMA, was relying on the uptake of the lesion, so the amount of signal you see in the prostate cancer metastasis that reflects the amount of protein PSMA target expression you have, was above the one of the liver as assessed visually. With that, there was a screen failure rate that was about 12 to 13% in the VISION trial. And we were wondering if we could use another organ of reference to maybe select a little bit more patients, exclude more patients to get maybe better response rates. And on the normal basis, in the PSMA PET scan, you have uptake a little bit in the liver, in the kidney, the digestive system, but also a lot in the salivary gland, and consistently. Usually the salivary gland uptake is about 2 to 3-fold higher than the one of the liver. And so we try to use a score or a grading system where you grade the PSMA uptake of the lesions not based on the liver as a reference, but based on the salivary gland. We created a score with the 3 categories: high uptake, highly above the salivary gland, low uptake, below the level of the salivary gland, or intermediate, based on the PET scan MIP. So it's like a whole body image summary, and you can interpret it in 3 seconds. So very rapidly, visual assessment for a fast and wide use at the end. That's what we aimed for. And we asked 10 blinded readers, experts across the world, to use that score and reapply it into a data set of patients we know the outcomes. They did that, and we were able to separate very nicely 3 different profiles of response to lutetium PSMA therapy based on the score. So ultimately, we hope that this can be, in addition to the VISION criteria, be used for better patient selection to lutetium PSMA therapy. Maybe we can say absence of PSMA negative lesions as per VISION criteria, and PSG score sufficient, no PSG score low, that will enable selection for lutetium PSMA therapy.